Welcome to today's presentation and thank you so much for joining me. I am your presenter Spongy and we're going to discuss leadership and management section D as a question. So this is a compulsory question and the structure of the question is as follows. So number one, you are working in an anti-retro virotherapy clinic as an in charge where you are expected to generate reports and ensure that you have enough stocks available at all time. So we have number one, A, define a report, which is 5%. B, explain 5 reasons for documentation in the nursing profession, 30%. Then C, identify 5 logistic management information systems, forms, and their purpose that are used in supply chain management and logistic systems. So this had 40%. Then D, outline the 5 key components of the ARV, EMLIP, and the HIV test commodity system. So this had 25%. So let's break down each section one by one. We're going to begin with definition of reports, which is A. So a report is defined as a structured document that presents information, findings, or recommendation in a formalized manner. So this is done in order to communicate data, analyze, or research outcomes to a specific audience. So that's a simple definition of a report. Let us now move on to B, which is explain the 5 reasons for documentation in the nursing profession, 30%. So the first importance is to provide accountability. So reports contribute to accountability by documenting actions, outcomes, and responsibility. The other purpose is to facilitate communication. So reports help to share information among team members, departments, or organization. Then the third importance is analyzation of data. So reports often include analysis and interpretation of data to support conclusions or recommendation. The other importance of report writing is it helps in aiding research. So in academic or professional settings, report documents or investigations help to achieve research findings and also come up with various solutions. So the other importance and the last one is informed decision making. So reports provide relevant information to aid decision makers in making informed choices in relation to patients, since we're looking at healthcare settings. Let us now discuss C, which is explain the 5 logistic management information systems forms and their purpose that are used in supply chain management. So we have number one, a supply voucher. So this serves as a documented authorization for obtaining specific supplies. So it helps track and control the distribution of resources within an organization, ensuring accountability and transparency in procurement process. The other one is a store control card, often used in inventory management. So it is a physical or a digital record that tracks the quantity of items in stock. So it typically includes details such as item description, stock levels, incoming and outgoing transactions, and data of movement. So this card aids businesses in maintaining accurate inventory records and managing stock efficiently, as well as in a healthcare setting. The other one is a drug logbook. So this is a record keeping tool used in healthcare settings, pharmacies, or any environment where controlled substances are handled. So it contains and also ensures that entries related to recipient, dispensing, and administration of drugs. So this log helps to ensure compliance with regulations, monitors drug usage, and enhance accountability in handling controlled substances. It also helps to contribute to patient safety and regulatory compliance. The other one is a daily activity register. So this is also a log or a record where daily activities. So this is where all daily activities and events are documented. So it can be used in various contexts such as organizations or any other department. So this register typically includes details like the data, time, nature of events, and individuals involved. So it serves as a chronological record, aiding in tracking daily operations, event or tasks for organizational transparency and accountability. The other form is a report for returning products. So this typically includes details about returned items. So this may encompass reasons for the return, date of the return, and also associated actions taken, such as refunds or exchange. So the report is crucial for organizations to analyze the trends in returns, identify potential issues with the products or service, and also improve customer satisfaction by addressing recurring problems. Let us now move on to question D, which is the five key components of the ARV, EMLIP, and the HIV commodity logistics systems. So the commodity logistic antiretroviral drugs, essential medicine list, and the HIV test kits basically involves several key components to ensure effective and efficient distribution. So here are the five key components. So we have number one, the supply chain management. So this includes the planning, procurement, storage, and distribution of ARV drugs, the EMLIP medicine, and HIV test kits. An efficient supply chain ensures that all these commodities reach their intended destinations in a timely manner. The next one is the storage and warehouse. So this is key point number two. So proper storage facilities are crucial for maintaining the quality and effectiveness of ARV drugs, EMLIP medicines, and HIV test kits. This involves controlled temperature, inventory management, and security measures to prevent theft or damage. The other one is the third key component is the distribution network. So distributing or distribution effective networks ensures that commodities are transported from central warehouses to regional or local health facilities. So this includes transportation logistics such as vehicles and routes to reach diverse locations. The fourth key component is the quality assurance and control. So rigorous quality assurance measures are essential to ensure that the safety and the efficiency of ARV drugs, EMLIP medicines, and HIV test kits. So this involves testing, monitoring, and adherence to international quality standards throughout the supply chain. Lastly, we have the information management systems. So utilizing information systems for tracking and monitoring the movement of commodities is crucial. So this includes real-time data on stock levels, so the consumption patterns and potential issues in the supply chain. Information management systems enhance visibility and facilitate decision making. So this marks the end of our essay section discussion. Thank you so much for your time and see you in the next presentation.